I'm Dr. John Pollina, and I am the director of the spine surgery program at the University of Buffalo Department of Neurosurgery. Our spine surgery program at UBNS offers the continuum of care for spine patients. Spine surgery and treatment of spinal disease is really entering a new era. We're using technology more so than ever before to treat very complex problems in very minimally invasive ways. Artificial intelligence, computer guidance, robotics, all of which are used in combination to allow us to treat patients very specifically to address the needs that are required to correct their spinal disease. This technology can be applied to all spinal patients with all spinal pathologies and diseases. Robotic spine surgery is unique to UBNS and to Buffalo itself. And this allows for patients to have much quicker recoveries, much more successful outcomes, because of the ability of the robot to assist us in surgery to create the solution specific to that patient's needs. Using these cutting-edge technologies, these newer innovative technologies to treat patients, it allows us to offer the patient sort of the best opportunity to recover quickly and to have a successful outcome from their surgery.